A risk assessment is a health and safety document that identifies potential risks in the workplace and outlines measures to control and minimize the likelihood of injuries.
Question: should there be a risk assessment for every task carried out in a workplace? The answer is yes, but if this was done, it could diminish their value as people may view them as paper exercises and not a genuine reason for concern.
As an example, if construction workers had to put on safety boots and gloves before going on site, there should be a risk assessment for each process.
A risk assessment telling people to check boots for mice, scorpions, and tarantulas could be created, but would it be needed?
Likewise, creating a risk assessment for gloves seems pointless, yet the risk assessment could be essential if the circumstances were different.
Imagine these are no longer construction workers' gloves, but health workers' gloves, who deal with infected blood and bodily fluids.
They need the exterior surface of the gloves to remain sterile when putting them on, and they don't want bodily fluids to touch their skin when they are removed.
Now there's a reason for the risk assessment, and once the risks have been identified, a method statement will be generated for the correct way to put on and take off gloves to mitigate risk.
One control measure would read, "Put on and take off gloves," as per the method statement.
Other control measures may be about hygienic storage, safe disposal, duration of use, etc.
Moving away from the specifics of health workers' gloves, the question any employer needs to ask before writing a risk assessment
is the risk tangible? If yes, it's time to sharpen your pencil and write a risk assessment. If the answer is no, then move on to other workplace tasks.
Think of a risk assessment as the document, and the evaluation of risks as the process.
So, assess the risks for tangibility, and create a risk assessment, only if there is a genuine possibility of potential injury.